Okay, so what I've set out for you is something called electrodes. So these electrodes are little sensors that kind of pick up the electrode negativity or the electrical activity that the heart is putting out. So when we are preparing our patients to get an EKG, what we want to tell them, because of all the wiring and how things look, we want to let them know that it's not going to hurt them, it's non-invasive, it's going to pick up impulses from their body instead of like putting something into their body, because that's what it looks like, right? Sometimes it can be scary. I know you've done EKGs before. Did you do them before? Okay. So you're the only one that we're kind of going from scratch with. Okay. So I will work personally with you. Let's see what you guys remember so far. So we know that these are the electrodes, right? In the wiring, you'll connect them to these electrodes. Now, what it's picking up is what we call leads. So you see here, there's 10 electrodes, but then when you read in the book, you're going to see that there's 12 leads. Can anybody tell me why? Long time ago, huh? A few months ago. Okay. So the reason you see 10 electrodes and it's called a 12 lead is because it's picking up tracings from 12 different areas of the body. So you have something called unipolar leads, and then you have something called bipolar leads. So you have two bipolar leads that are picking up tracing from two different areas. Okay, so instead of the 10, you have 12. And that's basically how that works. So let's go ahead and grab our electrodes. Okay, also in preparation, we want to let our patients know that the tracing can be interfered with if the patient has on metal, has any type of jewelry on, if the patient's moving, talking, or doing any of that stuff, we'll pick up what we call artifacts, okay? So you want to make sure that the patient knows to remove everything from the waist up and to remove any metal or jewelry, okay? And to remain calm. You want them as calm as possible, because we'll get something called a wandering baseline if they're moving around and doing things like that, okay? So in order to find the correct placement, just feel your collarbone, the top of your collarbone. The first electrode is going to go on the right side at the fourth intercostal space. You guys remember what intercostal means? Between the ribs, between the rib cage. So you feel the collarbone. The space under it is your first intercostal. Okay? So that's the space between the ribs. Okay? And then you're going to count down to 4. You're going to end right here. It's going to be like right here, right where the breasts kind of are the closest. All right? So that's going to be kind of the fourth intercostal space. So on our mannequin, it's going to look like somewhere around here. Okay? So it's going to be somewhere right around here, right? Yep. But you're going to go here. Because think about a person who has breasts. We're not going to be able to put it on the breast, right? So you want to put it right there. Okay? So that's the first electrode. Placing for the first electrode. So go ahead and put it on there, and then you want the tab facing downward. So all tabs are going to be facing downward. Towards the heart, okay? Another way of us kind of measuring it, it'll kind of be even with the, within that move here. Okay, now remember your second electrode is going to go directly on the fourth intercostal space on the left side. So it's going to go directly across, but you don't want them to touch. So you want to give it enough space. to where it's not touching. Okay, so you want to put it here. So you can kind of line it up here. So it kind of go there, right? And then the second the second electrode goes on the fourth intercostal space on the left side. So directly across from the first one on the left side. So closest to the heart. Patient's left side, not our left side. Okay. Good. You want to bring this one over just a little bit. Good, good, good. Okay. So we have the first and the second placed. In order for us to place 3, we have to find out where 4 goes. So 4 is mid-clavicular. That's one of those words. So this is our clavicle bone. So this is the mid-clavicular area. So the middle of the clavicle bone. So mid-clavicular area is here. At the 5th intercostal space. So this is mid-clavicular, right in the middle of the clavicle bone, and it's lined up kind of with the nipple here. So if you go straight down, but we're going to put it at the 5th intercostal space. So it's going to be right underneath the breast line, right there. So you can kind of line it up with the nipple as well. If they don't have breasts, it'll kind of be easier because you can kind of line it right up with that nipple, all right? Okay, so that's B4, right? That's the 4th electrode. So 3 goes midway between the two, between 2 and 4. But remember, we don't want to put it on the breast. So we're going to kind of go here. Okay. Perfect. Perfect. Okay. All right. So now we have 4. 5 is going to go on the 5th intercostal space at the axillary line. So if we all put our arms straight down, the line where the arm kind of meets with the front of the body, that's our axillary line. Okay? So it's going to be kind of lined up with the arm. Not the armpit, that's 6. Perfect. So 5th, remember the 5th intercostal, so it's aligned with these 2. Perfect. Those gloves, let me help you. All right. In 6, the 5th intercostal space, mid-axillary line. So with the armpit, it's going to be aligned with the armpit. At the 5th. So you're going to keep aligned with the other ones. There you go. And it's going to align with the armpit. So if you push your arm up, where your armpit is, you're going to align it right with that. Perfect. Perfect. Okay. And then the limb leads, you're just going to slap it on the arm. I usually slap it right on the deltoid, facing downward, and then on the legs, facing upward. I personally like to put them right on the calf, where the calf and the bone kind of meet. But you guys can just, they don't have legs, so just put it here. And then face upward. So, nope, not. Put it right there. Yep. My arm. I gave you all extra so that you, I gave you an extra just in case. A lot of times when our body temperature is a little higher, the electrodes, the adhesive on the electrodes, they'll come off. So when that happens, you should always have alcohol swabs, a little bit of gauze. You'll wipe the area, make sure there's no oil, there's no sweat or anything like that, dirt or anything like that, and then replace the electrode. Okay, so I put all of that there for you. Of course, our mannequins aren't gonna sweat, so we don't have to worry about that. So go ahead and grab the leads. So you wanna make sure they are not tangled. We're missing an electrode on the right arm over here. Unless you're gonna put that back in here. Oh, okay. Can you take yours? I'll put it back in. Okay. So I'm gonna come over here with you because you haven't done this before. You two have done it before, so I'm gonna let you go ahead and place the leads to the electrodes. And if you need me, just call me. I'll come over. Okay. So here, left leg. They're labeled, and then they're in a specific order. So if you are looking. If you're facing this in this direction, you want the left side to be on this side, right? You know, just flip it over, and I tend to just kind of sit that right in the middle of the patient, right? And then I will kind of throw where the electrodes belong. So this is gonna be the arm, the left arm. Kind of throw that up there, leave all the 6 precordial or chest leads right down in the middle. And I'm gonna do the same thing over here. So I will go ahead and place your right arm. This is right leg. I'm gonna place your right arm. Well, I can just place the right leg. I'm gonna move this out of the way. And you see that metal in there? It opens and closes. That's where I'm gonna put this tab. I'm gonna open it. I'm gonna place the tab right in the middle of that metal, and I'm gonna close it. Okay. Now remember, that's actually gonna be a leg, the tab. Same thing for the right arm, and then you can do all of the precordial leads, and then the left limbs. Okay. The tab. Got it? Okay. All right. Now this portion is the part that takes the longest in this entire procedure. So us preparing the patient by letting the patient know to remove all jewelry, metal, cell phone, any of that away from their body, and making sure we put the electrodes in the correct place. That's gonna take the longest. This second portion is gonna be about 5 seconds, right? Or let me just put a minute. So it takes about a minute to put all the patient's information into the machine, first name, last name, date of birth. It'll ask you about medication. It'll ask you if the patient has any conditions or anything like that. You can put it in the comments. It'll ask you who the provider is and then who's actually running the EKG. So that'll be you. So the provider will be of course, the doctor or the practitioner that you're working with, and you will be the person performing the EKG. So all of that goes into the computer, and once it has that, we'll press EKG and select. Okay? Now mind you, there's different type of machines. You get it? There's different type of machines, so you have to be familiar with the particular machine that you guys have in your office when you go out, okay? So some machine, they'll ask you more in-depth questions. Some will just ask you the very basic. And some, in order to run the machine, or in order to run the EKG, you may just have to click one button. So I encourage you all to make sure that you get very familiar with the equipment that you're going to be working with. Okay? So because you're not going to pick up an electrical impulse from these mannequins, we're not going to be able to run the actual EKG. So the placement, what we've done, and it all looks very good, is the most that we're going to do today. So let's go ahead and remove the placement, and then we'll talk about the difference between artifacts and arrhythmias, okay?